Cirrhosis is end-stage scarring of the liver. A normal liver actually has the amazing property of trying to regenerate itself. But when you have an ongoing insult to the liver, like fat and inflammation due to fat that continues to be in the liver, over time, the liver will start to lay down scar tissue. Cirrhosis is a very serious condition because not only are patients at risk of developing complications of end-stage liver disease, but they're also at risk for developing things like liver cancer, which in some cases might require surgery or even liver transplantation in order to cure. The most common causes of cirrhosis in the United States are really two things, and that's metabolic dysfunction-associated steatotic liver disease, or MASLD, and alcohol-related liver disease. Some patients with cirrhosis will actually have no symptoms at all. But when patients do develop complications of cirrhosis, what they might experience is fatigue, yellowing or jaundice of the eyes and skin, itchiness of the skin, easy bleeding or bruising, and retention of fluid. Some people can get swelling down in their ankles or their legs, that's called edema. Some people can retain fluid inside of their abdominal cavity, that's called ascites. The easiest way to reduce your risk of developing cirrhosis of the liver is to see your doctor and try to do everything you can to decrease your exposure to risk factors for developing liver disease. For example, if the reason that you're at risk for liver disease is due to having other diagnoses that are associated with MASLD, such as type 2 diabetes or high cholesterol or high blood pressure, the best thing you can do is work on those other conditions with your doctor in order to make sure they don't progress to a point where they're putting you at risk for developing cirrhosis. Another thing that's very important for patients who have liver disease is to really avoid alcohol at all costs, because these things can lead to more rapid onset of liver disease, but also steepen your risk for complications related to liver disease.